If I was looking for treatment for my own child, I think I'd be interested in a wide array of things. One is to make sure that the place that you're going really treats the conditions that your child has. This is true across many domains of medicine and healthcare, but certainly also the case in child and adolescent psychiatry. There are certain facilities that are going to treat certain disorders, and some may say they treat certain disorders, but really at the end of the day, it makes up a tiny sliver, not an integral part, and their staff and their docs don't have the expertise to be doing it. So you want to make sure you're going to a place where people really speak the language, whether it be an eating disorder and having people who are very eating disorder informed, or a substance use disorder and people who really understand addiction and chemical dependencies. These are important things when you're getting treatment. You don't take your Toyota into the Ford dealership, to get the repairs done, and you shouldn't do that for, yourself or your kids' mental health needs either. Beyond just making sure that the specialization and expertise is there, I think just get a feel for the program itself. If you can, be there in person, see the facilities, feel the tenor of the place, and talk to the staff. We have parents that come in and they want to take a tour. I gave one myself literally yesterday afternoon at 4 o'clock for 5 minutes to show the facilities that I'm very proud to be able to work in. So you really get a feeling, I think, when you're physically at a location of what it's going to be like on a day-to-day basis, for your loved one, for your child. So I want the feeling of the overall organization, knowing that they treat, what my child really needs treatment for. And beyond that, just making sure that, the day-to-day of what it's going to look like really suits what I'm looking for from a program. And so you'll find some programs that do, say, a whole lot of work with very specific lecture series, or, are very heavy in running specific skill groups. Other treatment programs like ours might focus a little bit more on process-oriented therapy. Some might focus more, like ours, and some of the newer therapy techniques, the third wave psychotherapy with the DBT and ACT, and mindfulness therapies that you'll start to see in a lot of these programs. So just making sure that if you have questions about it, and have an overall comfort of what is it going to look like for my child on a day-to-day basis, so that when they get home and I'm taking my limited time to engage with them, understanding that they've just went through a whole day of treatment, and the last thing they want to do when they get home is get the 10 questions from you, but just getting some idea about what my kid's going to go through on a day-to-day, and make sure I feel good and comfortable with what that day-to-day treatment's going to look like.